Hi. Every time you ask for the implant, we talk. Official in the field.
So my name is Dr. Albert Ha. I'm Korean American. Grew up in Southern California, in Los Angeles. Went to medical school at Harvard. Did my residency in urology at Columbia University in New York. And I recently completed my fellowship in andrology at Stanford University. No, it's a great question. I think there are a lot of very competitive fields out there within medicine, and urology is one of the most competitive to get into. Many reasons why, but long story short, there's only so many spots available for training, and there's a lot of popularity and demand for within the field. I really like urology for several reasons. It has a very big breadth and depth to the problem within the GU system, and there are a lot of different ways we can go about solving it. It could be medical, with medications, in-office testing, procedures, as well as surgical with operations that involve robotics, open surgery, and a lot of specialized equipment like cameras and lasers. So there are a lot of different ways in which we can tackle the problem. It's also the types of patients and the types of problems we deal with. Urology is a very interesting field in the sense that you get to deal with some of the most uncomfortable and most sensitive parts of one's life. Because of that, I think you can make a significant difference to the patient, especially in regards to the quality of life. And I think from that component, I was drawn into this particular field, sexual medicine and male infertility, which I specialize in. The implant is one of those surgeries I think most even medical students aren't aware of. Most lay people don't know that this exists. And oftentimes when they learn about it, they're very fascinated by it. And me too. I was very fascinated by this device and what it's supposed to do. And as a resident, I really liked how the operation seems straightforward at first. However, there's so much nuance to it. And what's more exciting for me is that there's no one right answer, to attack the problem correctly. So there are many different ways in which you can skin the cat, I suppose. And many different methods, many different approaches. And ultimately, our goal is to really provide a solid, good operation for the patient so that the patient can be very happy and really substantially improve his quality of life afterwards. I think the surgery, itself is very interesting. I think there's been substantial advancements in terms of technique and innovation approaches. It's one of those surgeries that people continuously refine and improve even for the past few decades. It's a very fun operation to do. It's very nuanced with a lot of small intricacies that people should be aware of. Not necessarily because it can lead to devastating consequences or complications, but again, it really focuses on the quality of life and making sure that our patient who has this device is very happy with it, comfortable with it, is able to use it effectively, and most of all, really improve his quality of life as he, restores that erection in his life. That's a very interesting question. I've sometimes wondered about this myself. We had a handful of Asian patients who were interested in the implant, also with erectile dysfunction and other ancillary problems. I think there still needs to be a little bit more investigation into this, whether it be a cultural barrier, language barrier, or just an access issue or even awareness. I do think there are certain groups within the United States where it's incredibly popular. Everyone is aware of this. It's almost just like a social norm for them. But I wonder if it's like that within Asian cultures. I suspect not. I wish there was an easier answer to this. Not necessarily to, compartmentalize different groups, but just to kind of conceptually make it easier for people. However, I don't think there is. Everyone's anatomy is very different, and I think that kind of speaks to why, as a urologist and as like a sexual medicine specialist, the physical exam is incredibly important. Everyone is going to be different anatomy, different size, different surgical history, medical history. A lot of it's going to be nuanced. And I think that kind of also speaks to why I like this operation the most, because there's no one right way or one same way to do this operation. For each patient, you might have to change things just a little bit just to make sure everything's seated perfectly. From measuring the size to different types of devices, which device is preferred, one or the other, also taking into consideration other factors within that person's life. If there is, I'm not too aware of it. But again, I think ultimately in my view, it's going to be individualized. I can tell you I've seen Asian patients with various different, considerations to their genitals for one reason or the other. Same thing with Caucasians, same thing with African Americans. And that kind of, again, speaks to the beauty of the surgery itself. And the ultimate goal for us is to restore that erectile function in a very individualized way so that, people are really going to be satisfied and going to get that quality of life back. Oh, it's fantastic. I would say it's been a blast working with Dr. Park this past week. I've learned so much just from talking to him about sexual medicine, penile implants, about life in general. He's been a great mentor so far, and I've really been humbled and very happy to have met him. He's been incredibly generous with his time and with his knowledge. I think moving forward, I really hope more and more people would be able to see what he does here. It's very different from the US. It's a different patient population, different country, but the beauty about a lot of medicine in this world is there are a lot of principles, a lot of things similar that I think all surgeons will benefit learning from and learning about. His reputation in the United States, he is a high volume implanter. He's very well known in the sexual medicine community. He's well known for his ability to successfully and efficiently perform a penile implant using local anesthesia. That is just unheard of in the United States. And I've always wanted to see somebody who would be able to do it like that. And me being Korean and having an opportunity to spend some time in Korea, I really wanted to, learn from him and see how he is able to pull this off, because it's amazing. Yeah, so since I'm fellowship trained in sexual medicine and male infertility, I do hope to make that a big part of my practice. Ideally, almost like a combination of both subspecialties. So dealing with medical and surgical issues within sexual medicine, focusing on implants and other aspects of other sexual medicine disorders, as well as male infertility issues, just sperm retrievals, varicoceles, vasectomy and vasectomy reversals, things like that.